Hello, everyone. Thanks for joining us today. We're going to hang on for just a minute or so while folks continue to come on. And I'll start by just asking if folks can, I see some familiar names here, if folks wouldn't mind popping in the chat where you're participating from. Hi, Jessica. So Warner Pacific is right here in Portland, Oregon. Oh, there. Blaine, Washington, San Jose. We had quite a few folks sign up today, so this is exciting. I actually thought at the beginning of the school year we might not have that many folks as we're all scrambling to get our courses ready. I don't know about you all, but we start Monday. Awesome.
I see in Illinois there. Thank you. Be cool today, Carrie. It's 100 degrees.
Caitlin. Hey. And Susan up there in Alaska. So we are, because it's the beginning of the semester, my name is Andra Davis, for those of you that I haven't seen before, and I'm at University of Portland in Oregon. And my partner in this work, Dr. Megan Lippy, is actually not able to join us today, but she is from San Antonio, Texas. So I see Sheila, you're over there in Texas as well. As we start kind of a new series of continuing these webinars, we thought it might be nice to get a sense about how many of you have participated before. And so Andrea is going to open up a poll. We will see how this works. Oh, Maria Ash, hello. We connected. We will connect later. So you want to take that poll away and we'll see. Here we go. So there's a couple of questions for you to answer. I think 3. Wondering if you've attended any of these webinars over the last year, and they've been ongoing now for over a year, and whether or not you are currently integrating palliative care into your graduate program. And your comfort with using the curriculum. That might seem like an odd question, but I'll explain in a minute. Ryan, would you mind kind of monitoring the chat for me? Or for us?
Sure.
Okay. So we have people still answering a little bit. It looks like is everyone able to see the running total? Yeah, okay, thanks. So it looks like about 1/3 of those that are here today have participated before, hence I recognize some faces. And this is your first webinar. So thank you so much for being here. And because of that, I'll give you a little bit of background and kind of what our vision is for these webinars. Palliative care integration, let's see, yes, about 26% have just starting, and then we want to, so almost 42% are kind of inquiring minds want to know, right? Which is fabulous. And then, we hope that we'll be able to help you gain momentum. And then comfort, 26% are very familiar. Use them I use them, but I'm not familiar. So this is why that question. I am seeing and learning that there are many schools that use some form of the ELNEC. They may use it, some parts of it in their program, undergraduate and graduate as well, but don't actually go in and look at it themselves. And so I think maybe I use it, but I'm not very familiar. So just as a reminder, you all have access to the curriculum for free. And Andrea, you want to tell them how they can get that really quickly?
Good morning, everybody. Sure. So if you just email elnec@coh.org, we can provide free access via Relias. Just let us know your email and your names, and we can connect with you.
And for the inquiring minds that haven't seen it yet, but are interested, you as well can reach out and say, we're considering using this. We'd like to look at the curriculum. Okay, so let me kind of launch and give a little bit of background about what these are all about and what our hope for is, our hope for these webinars. Oh, so share results. Everybody's been able to see it though, right? Oh, you haven't been able to. Say something, Susan. I see your head.
It just popped up. It was like a minute ago. It wasn't. It just popped up.
Oh, okay. Okay, so you can see the results there, and I'll just kind of leave them off to the side for a second so you can take a look at that. So about a year and a half ago, or actually over 2 years ago now, we had the opportunity to, through a Cambia Health Foundation, to Dr. Betty Farrell at City of Hope, I had a chance to join the team to support schools of nursing to advance palliative care education in schools of nursing. And so through that work, we developed these webinars to reach out to folks that may be familiar with palliative care education and teaching strategies or not, or those that want to do more of that. And the main big goal for us is to really network with each other, share resources, and attempt to not reinvent the wheel, because people are doing lots of really great things out there. And so the ultimate goal is for us to support each other and help schools move forward with integrating palliative care education in their schools. So I'm going to go ahead and start screen sharing here, and I'm going to go through the first set of slides pretty quickly because can you see my screen?
Yes.
Okay, thank you. The intent of this 1 hour time together is really to definitely spend a little time with each other, talking about what you're doing, ways that you might integrate this more into your curriculum. So I'm going to give a little bit of background, particularly since many of you this is new for you. So bear with me, those of you that have been through this before. Today, we are looking at the ELNEC Graduate Module number 3, which is focused on pain education. And we are alternating, the series is alternating between the undergraduate and the graduate curriculum for the rest of this school year. So next month, there'll be another webinar, and we're moving into the symptom module for undergraduate. And I'm going to take you to the website, which you may be familiar with, the Faculty Corner, where all of the upcoming webinars are listed, and you can register. We have Dr. Judith Paice here from Northwestern University in Chicago. And would you mind just giving us a brief overview of you really quickly, Judy?
Sure, Andra, thanks so much for inviting me, and thanks to all of you for carving out some time today, and for all the work you do in advancing palliative care education. So I am an advanced practice nurse. I have been involved with the ELNEC project from the very beginning. I was asked by Betty to help with the original core ELNEC curriculum, and have been involved with each of the other curricula as they have progressed over time. My clinical work, or my my real job is I am a clinician. I lead a cancer pain clinic within our hematology oncology clinic. I follow a caseload of about 200 people with cancer-related pain and some sickle cell and some hemophilia because we are a hematology oncology department. And I teach, unfortunately, sadly, Northwestern does not have a nursing school. I teach in the medical school, and I am a graduate of Rush. And so I do give some lectures for the NP programs there on pain. Thanks, Andra.
Thank you very much. So just to be clear, the intent of these webinars are to introduce you to teaching resources and not necessarily be an in-depth pain lecture. Right? So we're talking about pain education, and the resources that we'll go through are here to support you in that. But we're just really happy that Judy's here and is available to answer questions as we kind of move through this a little bit. If you have particular questions, she is really our expert in pain. All right, so again, bear with me, those of you that have gone through this before. Historically, this is sort of the background and context for how palliative care education has been sort of rising to a level of importance. More recently, back in 2017, the ANA Professional Issues Panel and HPNA, which is the Hospice and Palliative Care Nurses Association, came up with a general call to action that nurses lead and transform palliative care education, palliative care and education. And so the momentum really since then has continued. And we all know, probably all of you know, maybe you don't, the new essentials that came out last year, nodding heads maybe, are familiar with those. And there are 2 levels, and we're here to kind of address the advanced level 2 competencies and subcompetencies. And if you have questions as we're going through, feel free to pop those in the chat. So another really big change with the new essentials was the integration and acknowledgement of hospice and palliative care as a core central component of nursing education. And that is new. And so we are one of 4, are one of 4 of the spheres of care that all nursing students should be provided education around. So many of us here today have recognized the importance and value of that as practicing nurses, and with our students, the importance of this, and for patients ultimately. But now to have it be part of accreditation is a new level. So very quickly, part of the work of the ELNEC folks, along with in collaboration with AACN, was to develop competency statements for undergraduate and graduate education. When the new essentials came out, those had been in existence before the essentials came out. But when they came out, there was a team of us that said, let's take a look at those and see how well they align with the new essentials. And out of that examination came revision to the competencies for palliative care education for graduate and undergraduate. So this slide, we're only speaking about the advanced level. So they were revised to be what had been separate competency statements that were directed at all students, graduate students, masters in DMP, and then a separate set that were for those in graduate programs pursuing direct care. So the difference between, well, you all know what I mean. And so what we did to align with the new essentials was they are not delineated that way in the essentials. So we came up with a combined 12 competency statements. Those are available on the website. We can add them. These slides, as well as the handout you'll get a little bit later, will be emailed to you after the webinar. So no worries, you'll get this stuff later. So what I did to just sort of reinforce the the value and the synergy across the GCARES are the graduate competency statements. And there were two that really aligned very well with particular ACN domains. And this is getting a little bit in the weeds. Those of you that are familiar, you may recognize these, but there are 10 domains within the essentials. And we identified 1, 2, 3, 4, 5, 6 that aligned with the new GCARES number 8, which is to promote delivery of care that supports holistic assessment and management of pain and symptoms common in serious illness at the full scope of practice. And then the next one, number 10, consult with specialty services for complex palliative care issues that exceed one's functional area of practice and educational preparation. And all of the previous domains with the addition of number 6, which is interprofessional partnerships, aligned with this particular competency statement. So Dr. Paice mentioned she's been with the team since its inception, which was 2000. And you can see on this slide sort of the historical development of many different curriculum. And these were all geared towards practicing nurses. How many of you in here have taken any of these courses? You may be familiar with these courses. And we have one coming up, by the way, yeah, so maybe Ryan or Andrea, you want to mention that or put information in the chat for those that might be able to be in the area and hop over to, oh gosh, where are we going? South Carolina.
We'll be in Charleston, September 25th and 26th. I'll post the registration link here as well.
Okay,
we
great.
offer a discount for schools of nursing faculty as well for $100 off per person.
So the graduate curriculum, which is an online program for schools of nursing, the vision that Dr. Betty Farrell had was sort of the last to move things upstream in terms of education. So she had funding to develop the undergraduate curriculum, and then later in 2019 developed the graduate curriculum, which is a series later. I think my next slide. Oops. Yeah. So it's a series of 7 different modules. We today are going to just take a little peek at some of the way that the pain assessment and management module for graduate students is laid out. You're using it, but maybe you haven't looked at it lately. So we'll take a look at it, and I would encourage everyone, if you're using it or considering using it or just need to review it, to get a token, get a, what do we call it? Like a subscription for a year. It's for free and you can renew it as much as you want from City of Hope. So to date, these are the number of undergraduate schools and graduate schools across the country that are using this curriculum. And we keep these metrics every month or so, I think, Andrea, regularly, and they continue to go up and up and up. Maybe a reflection of the new essentials, possibly people recognizing the importance. So I'm going to pause here, and we're going to take a look now at some of the aspects of the module, and it might be a good chance to ask a question if you have any questions so far while I switch over. I can't see. Are there any questions?
Not just yet.
Okay. Oh, yes. Okay. So again, the intent of this drive-by view is to just show you kind of how these are laid out. These are the undergraduate curriculum was just revised, and for those of you using it, as you launch, if you're using that in this fall semester, it will be a new curriculum. It'll look different. So these are revised every 3 to 5 years. Is that right, Andrea? or Ryan?
I
Or
know
do-
in other curricula, we try to revise them every other year.
So for undergrad and graduate, we revise it every 3 years, or usually a big overhaul every 3 years, but every year we actually update references and whatnot, but a big overhaul is every 3 years.
Thank you. So I believe that the graduate curriculum is due for a revision in the next year. So what we're seeing here today is what is available for students and you right now. All right, so I ran through the course already early this morning because you can't advance anything until you open everything. And so that's intentional, right? It doesn't make it easy for me when I'm presenting it to you, but it's important for the student interface, right? That we make sure that they are reviewing all the different pieces. So here's, I think, Dr. Paice, you are at the core of the original development of this module for the ELNEC online graduate curriculum. Yes, we see you a lot in this module.
And it's a very old picture.
So there are specific learning objectives. I think this is really important for you if you're using this module to go in and look and see what are we assigning our students to do. And at the end, what we hope is that you walk away with a greater understanding of what this resource is for you, as well as how you might unpack some of it and explore things more deeply in the classroom. I know that in the undergraduate program in particular, I don't see my colleagues here that are teaching in the DMP program, but it is, one approach is to assign it as an assignment, and they do it offline as a homework assignment. And then maybe we don't really explore some of these really important concepts in the classroom. And so we are encouraging folks to do that and have supplemental resources for you to lead you and help you in that. Okay, so I have particular things marked out. So we have, this is an example of, because again, I've already opened it. You can't proceed unless you open each one of these boxes. So if I click on the physical, psychosocial, psychological, social, and spiritual, it looks at the psychosocial spiritual model of care and pain. And then number 7, I'm going to go down here to 7. I want to show you here one of the other, we're not going to play this, but this is a vignette where Dr. Paice is interviewing a patient. And after that 10-minute interview, there's kind of a key points from the interview. This is also a great place for you to come back to in the classroom and discuss this with the students, see if they, were able to identify these key points and so forth. So here you go. Assess the impact of the pain on function, not only a 0 to 10 rating and so forth. And let's see, then let's hop down to groups at risk for undertreatment. And I need to kind of go through these slides a little bit one at a time to get where I really want to go with you. So you can see the different populations that are recognized. Now I'm going to share this, and give me a thumbs up if you can hear it okay. We'll just, this is sort of a testimonial. It's a different way of engaging with the reviewers, the students. The other one was a vignette, a practice interview. This is Connie Dolan, who is a nurse practitioner, and she's sharing an experience of working with a particular population in terms of pain assessment. Now, let me know if you can hear.
So let me tell you about a patient who was unable to report pain. Mrs. S was a 78-year-old Italian woman in a nursing home where she'd lived for a number of years. And this was an Italian neighborhood, which had many Italian-speaking staff and also other residents. Mrs. S was quite lovely. She would be singing Italian songs throughout the day. And one day she kind of was stopping singing. the staff sort of noticed that she was having a growth on her throat, and they had this clinical people look at her throat and decide that perhaps she had a tumor growing. And so we were asked to come in and evaluate her, and we looked at her throat and palpated her neck, and just in touching her would notice just her nonverbal communication of a startle response and pulling away from us. But also we noticed that her singing changed. And when we gave her pain medicine, she started singing very vibrantly. And when her pain medicine was wearing off, she would stop singing. And so we were really using her own way of communicating with us about singing to both monitor her pain level and to determine when her pain was worse, because when it got really bad, she would stop singing completely.
Okay, moving on. Here's another example of one of the functions in the modules. So we're right now in pain management. So it's an overview of the different medications. And with the oral medications, there's little droplets from the capsule that you click on, and it gives you different information. And the students need to review each one of those before they can progress. And then at the end of it all, there's essential principles that are reviewed. Again, I would encourage everyone to go through all of this. And essential principles of pain management are sort of summarized here on this slide. I want to take a second and see if Dr. Paice has anything to add about the use of, when we teach students about equianalgesia, if there's, there's so many different tools out there. And I think in a conversation we had somewhere recently in the last year, you mentioned some new guidelines coming out.
Oh, thanks, Andra. This is actually a hot topic, and one that is, it's generating a lot of interesting debates. There, if you are really interested, Jerry Pal had a podcast about this and also sponsored a debate. So there is a lot of controversy. These numbers are eminence-based medicine. They are not based on randomized controlled clinical trials. And there was a belief that we needed to do an update. And so a group of us representing the American Academy of Hospice and Palliative Medicine, the American Society of Clinical Oncology, and the Multinational Association for the Supportive Care of Cancer have been meeting. And I need to tell you that we went through something like 1,500 different abstracts, and we could not come to like one true equianalgesic table. We are now working on a Delphi to see what are the general beliefs regarding this. I'm skeptical that we're going to come out with a table like this. The debate really revolves around, are these fixed numbers? So 10 of morphine IV approximately equal to 30 of morphine PO. Is that ratio of 1 to 3 the same if you're going forward or backward, or if you're going from morphine to oxycodone? And in fact, that Jerry Pal podcast suggests that actually they aren't bidirectional, and a better way of using these numbers would be having conversion factors. But the complication there would be for every single potential change, morphine to oxycodone, morphine to hydromorphone, morphine to hydromorphone IV, you would have about 60 or 80 different conversion factors. So is that feasible too in terms of teaching? So the bottom line, frankly, that Marilyn McPherson, who's written books on this, espouses, and I agree with her wholeheartedly, is that you choose one of these tables, if you will, and then your team, your clinical team, all decides to use that one sort of document of truth. And that way you will be safe as you are making these like rotations or tapering as you're working with patients. So it's really complicated. And we had hoped that there would be some guidelines out. The process has become much more complicated. So sorry, Andra, that got into a much more robust sort of discussion, but
No, I think that's exactly, that was what I'd hoped is, that, this is an area where, and I'll just sort of venture out in this regard. If faculty come to these courses, there's an opportunity to dialogue a little bit more about what's going on. If you feel like, you have limited understanding of these moving targets, if you will, that's a place to talk with colleagues and hear from experts.
We do have a question also.
yeah.
Joy Wang asked if there is one for neonates.
Yeah, this is not the table. This typically is the table for adults. I'm not aware because I don't really work with children, sorry, or neonates. There probably is another table. I don't know what that is. And basically, I think with neonates, you guys don't use so many of these oral medications, if I understand correctly. So yeah, this would not be appropriate for that population.
Good question, though. Okay, so let's finish up taking a look here. I want to bring us down to the safe practices section. Will it let me get right down there? There we go. This is really an excellent last section that addresses substance use disorder. Safe practices, the principles of safe practices, here again, they all are. And as I mentioned, I've already gone through everything. So so students would go through this talking about opioid management agreements or not, or how that might look. And Dr. Paice does address that in one of these videos. I think I'm just going to close out with a little bit here from our own Dr. Paice.
For those of us who provide care to people who have a serious illness, who also have significant pain, it's been a challenging time. We have the need to provide safe and effective pain management at the time of an opioid epidemic. So how do we find the balance in providing appropriate care and not contributing to the societal problems that we're facing? So with each individual patient, and this is with every patient, we need to conduct a thorough assessment. And it isn't just asking about the pain intensity, it's also asking about the full pain assessment and function. So if we could provide better pain control, what would you be able to do that you can't now? So really our outcome isn't focused on a number. Our outcome is focused on functional ability. And then there are some additional pieces to the assessment. We need to assess the patient's risk for misuse. And that includes questions about their past use of recreational substances, as well as things like smoking and alcohol use. We also ask about family history, because there may be a genetic component. It's a pretty crude measure, but still it helps us to understand if there has been a persistent prevalence of substance use disorder within the family.
Okay, I'm going to stop it there, and hopefully we've enticed you. You'll be getting access and going through. I believe that the module, it's estimated that it should take somewhere between an hour, maybe an hour and a half to fully go through. The vignettes are, I think the longest recording is 10 minutes, and then they're all shorter than that. So the idea is that it should, as you kind of do planning, take somewhere between an hour and a half for students to move through this. There are a variety of ways that you may integrate this into the curriculum and the classroom. And so with that, here's our opportunity to get into smaller groups. And Andrea, if you wouldn't mind dropping the document, the supplemental resources into the chat so people can download that.
And real quick, Andra, sorry,
Yeah.
there's another question. Carrie asked, is there a preferred tool that our EQ and students should be directed to in order to identify risk?
Judy?
I was just writing in the chat box. There are several tools. One is called the SOAP, and there's actually a revised SOAP R. You can just Google these and find them. There's an opioid risk instrument. I would say that the challenge in palliative care is that none of these have been validated in this population. They've primarily been validated, some better than others, in chronic non-malignant pain populations. So they have strengths and weaknesses. I find that patients who do have substance use disorder risk some individuals tend to really understand social desirability issues and know how to respond on a paper and pencil type tool. And so I tend to prefer, if for my own practice, to do this through a good history taking. I'll give you a quick example. About 2-3 months ago, I was going through my usual checklist, asking a patient, and the question about abuse came up. That's my last question. And I always give somebody a palliative care warning shot. And, now I have a very difficult question to ask you. And then pause for a second so they know this is serious. And all I asked was, have you ever been abused? And he started sobbing. So I did not need to know the details, but it was clear this gentleman's life had been impacted terribly by what we know to be one of the strongest predictors for substance use disorder. And in fact, when he did require opioids, there was some misuse. I think he was very much treating the emotional discord that remained in his soul, his heart, his world, related to this past treatment. And so we had to set really, really clear guardrails to ensure his safety.
Wow. Thank you so much. And I really appreciate the resources that folks are talking about here in the chat as well. And so the document that we just sent you, I'm taking notes, and I want to add some of these other resources to that so that you'll get a different version when it's emailed out to you later with some of these tools. We're going to break out into 4 groups so that we can have smaller discussions. Some things to talk about. How have you incorporated ELNEC in your program? Again, overarching purpose of these monthly webinars is to connect with each other, not reinvent the wheel, use the, take advantage of the wonderful experience and expertise of others that have been are at various stages of doing this in the curriculum. So we really want you to do that and keep coming back. Share successful teaching things that you've been doing. I'll share with you, the Faculty Corner as we close has an evolving section of teaching resources that those of you that are proud of the things you've been doing in the classroom, we would love a summary of that on the website for others to adapt. And then the second activity, if you will be to take a look at this document. And there are some videos here. These videos are all within the module that we just reviewed. But if you, say, for example, wanted to pull one of them up in class, separate from the module, here they are if you want to dive in a little bit more and explore things with students. And then there's some case studies and different things for you to think about in the classroom or have students do. An article around human rights and the importance of pain care. There's a case study and a little bit of debriefing guidelines. Of course, you can adapt all of this. So as we're in groups for maybe 10, 15, maybe we'll call you back. Take a look at these resources and how might you use them in the classroom, or are you using other things? So with that, I'll let us peel off for a little bit when we had to leave. Any important things you want to share? Oh, we lost a lot of people when we went through that breakout. Note to self, about 10 people, maybe people had to leave. or maybe they were nervous about talking in a group. Either way, anything you want to share before we kind of close up? And we have one more last question for you, and I'm going to show you the faculty corner. Okay. Well, here's the last question while we take a look. Oh, go ahead. Was someone going to speak?
Yeah, someone was asking about, like, if the faculty have access to the ELNEC modules and things like that, are we allowed to use that as faculty with our students, or do all this, is that like copyright, or do we need to have? And you and I have talked about that before, where I've gone through and done this with my students in the class, and it went really well.
Yes. Yeah.
And
Yeah,
so
so that's not a copyright issue. Here's the little bit of dilemma, and certainly anybody from, you know, Andrea, Judy, anybody help me out if I'm speaking incorrectly, but there's a cost to the modules, right? We're in the process of renegotiating with Relias, which is the platform that delivers the modules and sort of houses what you saw. And the payment model is shifting because we've given them lots of feedback about, you know, many of the reasons that can be a barrier. There are ways to address that. But anyway, that's a little separate conversation. It's $29 a year, but we're renegotiating with them about how that might look differently, because maybe you want to use this over a longer period of time and students shouldn't have to, you know, pay for it again and blah, blah. So one way to do this is to do just what Jessica mentioned, and that is to pull it up, your free token in the room, and go through it in the classroom. That is a model, and Jessica, you've done that before. Anybody else want to add anything there? Oh, the caveat is, at least for the undergraduate, I think graduate too, maybe, I'm not sure. If the student doesn't actually do it, and there's great value, particularly in undergraduate, with getting the certificate of completion and adding that to their resumes as they go out into practice, it's valued among our clinical partners. So if you do it in that model, they don't have that. They can't have that certificate of completion. So that's the caveat.
Yes, Andra, what you said was correct. So a lot of folks have done hybrid, where they will teach it in the classroom, you know, on their screen using their free resources. And then the students could go home and finish the modules, but you are more than welcome to share your screen while you're teaching. That's totally okay. Many faculty have done that for the hybrid.
Thank you. I am okay. Joy has a question. Do you recommend using the entire module in one semester? I think it depends on the best alignment with your courses. And we were talking, Christine and I were just talking in our breakout about they're in the middle of developing a master's and trying to figure out how to disseminate that, right, Christine?
Yeah, we're trying to figure out how to really thread palliative care through our whole curriculum. I'm eager to look at the crosswalk that you all did with the AAC and Essentials, because we really want to, again, we're thinking about accreditation and our self-study, right? Like the big one, we have to be very clear if we're going to name it in our student learning outcomes. If we're going to name ELNEC competencies, then we just to assure that it's going to be threaded throughout. It's not just like kind of stuck in the corner.
And just so you know that the ACN board endorsed them. So there is buy-in, if you will. So I just put in the chat, and I think, Andrea, I'll send you the article. It might be useful to have folks have that. So we'll send it out afterwards. Thank you. So here is I mentioned earlier, the faculty corner. And while we're looking at this, if you all would just put in the chat, what is the most useful way for these webinars to sort of be designed. Is this useful for you? Are there other things that you had hoped to get from this? Because many of you, this was your first time here. That would be really helpful for us to know so that we can pivot in ways that best support you. So I put in the link. So if you could do that in the chat, that would be really great. Here's the faculty corner. Here's where I mentioned you can sign up for future webinars. We have past recorded webinars. That's where this one will eventually go. We have some faculty spotlights. Susan is here today. We spotlighted some of the work that great work that she's doing. Teaching resources, I mentioned, we have this growing body of resources, simulation, and teaching resources. So if you have been inspired to share some of the things that you're doing at your school, we would please send them to me. You can, or ELNEC, and then I'll get it one way or the other, and we'll put it up here and give you credit for that. You can add it to your CV as, professional service. So I think that's all I have to say. If anybody has any closing thoughts or questions. Otherwise, okay, great. I'm glad it's helpful. And come back, bookmark that, and we continue to add resources there. So Dr. Paice, thank you very much again for being here. We really appreciate having you here. You can just off the top of your head share current practice, and it's highly valuable. Again, if you're interested in coming to a training, there's one coming up in a month. Otherwise, we'll be posting on the ELNEC website next year's. There's 2 a year. So thank you, everybody.
Thanks, Andra. Thank
See you
you.
next time.
Bye-bye.
Bye-bye, everyone.